I am in a car driving down from this beautiful spot up in the Himalayas, and there's this amazing beauty everywhere. But the only thing I can think about is, oh my, where is the bathroom?
Yeah, I remember that trip. I was also in a car, and I remember I could feel every bump on that road.
And this is how so many people with incontinence feel every single day of their lives.
And it's significant because we all have the moments when we really needed to use the bathroom. And we all remember how uncomfortable it is. Now imagine to live like that every single day.
And you know, the numbers are not inconsequential. According to the Center for Disease Control, 44% of people 65 and over have some degree of urinary incontinence, and that number jumps to 70% to those who live in a long-term care facility.
Think about those numbers. That means almost 1 in 2 people over the age of 65 have that issue.
And this is such an important issue because some of the treatment that is associated with urinary incontinence can affect the way that our brain works.
So wow, there is then a trade-off between treating incontinence or maintaining your thinking.
Absolutely. So the way that these medications work is that they block the action of acetylcholine. And acetylcholine is the neurochemical responsible for the contraction of the bladder muscle. So when you block the action of acetylcholine, it helps the bladder to relax. And when the bladder relaxes, then that reduces the symptoms of urinary incontinence. The problem is that we also have acetylcholine in the brain. And when we block the acetylcholine in the bladder, we also block the acetylcholine in the brain. And while in the bladder, acetylcholine reduces that muscle contraction, in the brain, acetylcholine is one of those neurochemicals that is responsible for memory, for executive function, and for cognition in general. So yeah, this is the big trade-off, that on one end, these medications can help you to be more continent, but at the same time, they can create significant problems in the brain, like brain fog, worsening of memory, worsening of executive function, etc.
I remember when we were visiting your parents, when your dad was still alive, the first thing you would always do is check their medicine cabinet. I clearly remember walking into their house, and then you would open the medicine cabinet and you would say, who is taking this bladder medication? So to understand a little bit better, if I don't know anything about those medications, and now let's say I have a friend, Jenny, and she's 65, and she experiences incontinence. So she goes to the doctor, she takes the medication, and then what would she experience as effects of that medication?
Okay, so Jenny, for example, may begin to take this bladder medication, and she may not notice anything right away. But as the weeks and the months go by, she may begin to notice some subtle changes in her cognition. Like, for example, maybe not remembering things quite as well, maybe having some problems with planning, maybe having some problems with her visuospatial awareness, driving, not knowing quite where she is with when she's driving her car. And this is not unusual. There are actually studies that show that even in those adults who have normal cognition, to take a chronic anticholinergic can result in symptoms similar to mild cognitive impairment.
Wow, wait, so let's say if Jenny was just a normal functioning woman, by just taking that medication over a period of time, she may develop the symptoms that can be diagnosed as a mild cognitive impairment.
Absolutely, and the data supports that. Actually, this particular study that was from France, what they found was that 80% of those older adults who took an anticholinergic chronically met the diagnostic criteria for mild cognitive impairment. And what was important to note is that if you stop taking the medicine, the cognition then returns back to normal.
Well,
So
which is good news for Jenny.
For sure. So it's important to recognize that these medicines for incontinence can create problems, but also the good news is that if you stop them, then the cognition can return back to normal, at least in the younger population, the people with a more intact cognition.
Now, what happens if she continues taking that medication? Because as far as I understand, usually mild cognitive impairment one step below developing Alzheimer's disease or dementia. That's our kid saying hi.
So, there is an association between anticholinergic drug use and incidence of dementia. So we cannot necessarily say that there is causality, but it's definitely an association. And the longer that we take these anticholinergic medications, the higher our risk for developing dementia.
Wow, which is huge. And understanding how devastating dementia is, to just realize that there's even an association from a drug taking that medication to develop those symptoms is huge.
It is a big problem.
She agrees.
Yeah, it is definitely a big concern.
You mentioned that in your practice, that's the medication that you stop the most. And you work with people who already have dementia. But how would that affect them? Why would you stop it?
I got a call to come and see this gentleman at one of my facilities. And they're like, please come and see him like right now. He is just terribly agitated. He's had multiple falls. He's having visual hallucinations. He's even stopped eating and drinking because he thinks that the staff is trying to poison him.
And you put him on antipsychotic medication?
Absolutely not. I actually reviewed his medication list, which is one of the first things I do. And sure enough, there it was. A bladder medication had been started about 10 days prior to the symptoms starting. Ganga brings a good point because many times what would happen at this point is that the patient gets prescribed some sort of a medication to calm him down. But because I had this awareness about the problems with bladder anticholinergics, when I saw that medication, I stopped it. And within 2 or 3 days, he was back to his baseline. He was back to being, no longer agitated, no longer hallucinating or delusional, and no more falls. So just by stopping this medication, we were able to return this gentleman's mental status back to normal.
Just one medicine can have that profound an effect.
Absolutely. And what the data shows, in those people who have a dementia established, approximately 50% of those people are taking at least one medication that is making them worse. And 20% of those patients were taking at least one psychotropic drug. So to have the awareness that medications can make people with dementia in particular worse is really worth having. There is a quote by Dr. Gerwitz who says that any symptom in an elderly person should be considered a medication side effect unless proven otherwise. And this is definitely how I do my practice.
Okay, so far everything that we talked about is good, but then what do we do?
Okay, so if you are a younger person and don't have any incontinence, then my advice is lifestyle. And what I mean by that is that the lifestyle choices that we make that provide us with brain health, with heart health, with bone health, will also help us with bladder health. So what things am I talking about? Number one, a plant-based diet. Number 2, stress reduction. Number 3, physical activity. Number 4, socialization. So things that we can do to promote our overall health will also help our bladder. And there's actually data to support the use, for example, of a vegetarian, plant-based diet for bladder health in general. And actually there's some studies that show that a vegetarian diet is protective, for example, against urinary tract infections. Okay, number 2. Now, if you are just beginning to develop issues or problems with incontinence, in addition to keeping this healthy lifestyle, which is the basis of everything important, then you may want to look at bladder irritants. And these are things like caffeine, alcohol, tobacco, carbonated drinks, artificial sweeteners, and other things that can irritate the bladder, making that bladder muscle more likely to contract, which then can lead to more problems with urinary incontinence. In addition to avoiding bladder irritants, it is really important to exercise our pelvic floor muscles.
And it's good to do at any age. In yoga practice, we call them mula kriya. And of course, it's not the ultimate goal of those practices, but hey, it's good to exercise those muscles.
Absolutely, and it can make a big difference to really retrain those pelvic floor muscles. Another name for these exercises are also Kegel exercises, which you may have heard of. But the idea that by strengthening these muscles in our pelvic area, we can help to reduce the symptoms of incontinence is really beneficial.
So what do people with dementia do?
Well, as you can imagine, for people with dementia to engage them in doing some pelvic floor exercises may not be as easy because they may have just problems understanding how to go about doing that. So what we do a lot is, number 1, use incontinence gear, so things like Depends and other types of undergarments that can be used for that. Number 2, also what is called bladder training, which can involve, for example, making sure that the person with dementia is toileted like every 2 hours, for example. And that can, to encourage the person to go, whether they need to actually use the bathroom or not, can help to decrease accidents, and it can also help with issues with their own dignity. So, with this bladder training, the object is that, for example, you begin toileting somebody like every couple of hours, but then little by little they may be able to extend the period of time that they can take in between times for using the toilet.
I love that you mentioned their dignity, because I think that sometimes we don't think that a person with dementia still feels just like we would, and it's embarrassing, but they can't do anything about that.
For sure, and I think that is one of those things that I try to keep at the forefront of my interactions with my patients, is to make sure that no matter what, that we try to preserve their dignity and respect as much as possible. Also, it may be the time to really try a medication. And in that case, what I would recommend is to avoid the either anticholinergic or antimuscarinic, they mean the same thing, medications for the bladder. And there is a newer medicine that is out that is called Myrbetriq, Myrbetriq, which is a medication for incontinence. It's fairly new, it's fairly expensive, but it does not have those profound and dramatic effects on the brain. It definitely comes with its own series of possible side effects, but in terms of cognition itself, it is a more benign medication to try.
As far as I understand, you're not against medications. It's just to be aware when and how we're using them.
I really believe that every form of healing has its place. But I believe that things, and particularly with those people with dementia, that we really need to have this awareness that anticholinergic medications can fix one thing but break another. We hope that you found this video useful. If you have any questions, please leave them in the comments below and we will see you in the next video.